Hi, good morning, everyone. Thank you for joining us here today. My name is Sean Evans. I am the President and CEO of the Meridian Chamber of Commerce, and we're very happy to have you join us today. We're still seeing some people join, so our moderator will be adding them as we go, and we are looking still for a few of our panelists to join. So Marlene, if you would mind, I think John joined. If you would make John a unmute John Jensen. And John, if you have a camera, you could turn your camera on.
John has been unmuted.
I can hear you. Is my camera not on?
I can hear you too, John. So you're welcome to share your web camera if you want to. I think there should be a green button to share a webcam. All right, well, let's get started. And Marlene, if you'll keep a lookout for our representative from Central District Health as well.
Will do.
John, you're good to go with voice only if you need to?
Yes, I can't see a green button on. Maybe I'm perhaps in the wrong mode. I apologize.
Okay, no problem. The Meridian Chamber of Commerce, in partnership with the City of Meridian, Central District Health, and Crush the Curve Idaho, and numerous partner organizations and individuals, is proud to announce the launch of a program that will assist Meridian businesses as they open for business. Our campaign will not only educate businesses on the basic guidelines to reopen based on the Central District Health and CDC guidelines, it will allow businesses to demonstrate to the public that they are doing so in a manner that will keep Meridian healthy and open for business. Online and speaking with us today are just a few of the partners and organizations that help develop this program and support the Meridian business community, as well as local businesses leading in best practices when it comes to safely reopening. Joining us today will be someone from the Central District Health. We also have John Jensen, store manager of RC Willey and a Meridian Chamber board member. And from Crush the Curve Idaho, we have their executive director, Tina Upton. We will open it up for questions at the end of the presentation. The premise behind our campaign, getting businesses open and restarting our economy, is why this group had started. We had initially pursued efforts to get everyone open early, but we also saw the bigger issue of opening amidst the COVID-19 crisis. The big question is, will the public return to the stores when they reopen? We're contacted daily by our business members on how does the governor's plan apply to my business? When can I actually open? And what guidelines do my businesses need to follow? While the Meridian Chamber of Commerce is not an authority on this plan or the recommended guidelines, we are here to help the Meridian businesses understand them better. The last thing we want to happen for our local businesses is that they go to the effort and expense to open, bring back employees, restock their shelves, and the public, the consumers, not visit their establishment out of the fear of or concern for their safety. The Central District Health and the CDC have developed some guidelines to reduce your risk when out in the public if businesses can follow these guidelines as they reopen and demonstrate to the public that they're serious about the public safety and health. Then that will build consumer confidence necessary to restart the economy. The Meridian Chamber is launching Keep Meridian Healthy and Open for Business to help our businesses build that consumer confidence. As the businesses open, according to the governor's 4-stage Idaho Rebounds program, we will assist Meridian businesses by conducting industry-specific webinars that will provide information from the Central District and CDC on basic guidelines for that industry. The webinars will also feature local business leaders that have taken even further steps to ensure that they are reopening in a safe, responsible way. After the business participates in the webinar for their industry, they will be provided free of charge collateral material to assist in encouraging people to visit their stores. Those collateral material will include door stickers for recognize them as participating in the campaign. It will also include posters for in-store display, posters that kind of outline the steps that they have taken and what they're doing with their employees and encouraging their customers to do to create a safe and healthy environment. We'll also be distributing social media materials so that these businesses can then share this information online to encourage the public to visit their business. And then also we'll be including the participating businesses in our website and our marketing campaign as our program goes beyond and reaches out to the public and encourages them to shop local, shop Meridian, and visit the businesses that are doing their part to keep Meridian healthy and open for business. Our program goes a little beyond what some other communities are doing by just creating a list of businesses that are complying. We're helping them understand what this means for their business and sharing best practices from other industries and specific leaders. Guidelines out there are not a one-size-fits-all solution for every business. We don't know what we don't know. The industry-specific webinars seek to educate beyond a sheet of written guidelines, educating businesses on the additional protocols they can implement for their specific type of business is where the value comes in, and what the value is in safety for employees and customers. One key point is to be in compliance with the governor's 4-stage plan. Businesses will only be provided the collateral material when their business is scheduled to open according to that plan, whether you're in stage 1, stage 2, or stage 3. Also, following up after opening, the participating businesses will be encouraged to answer surveys from the Meridian Chamber on how their opening is going and the sentiments of their patrons returning to their stores and businesses. This is really going to be helpful in helping us guide this program and for our city and government officials to be able to monitor and assist where they can in the reopening process. All right. Marlene, do you know if our presenter from the Central District Health has arrived?
Unfortunately, no, he has not arrived. I have sent some messages and made some phone calls, and hopefully he will jump in as soon as he can. So I will let you know if he is able to join us.
Okay, excellent. Well, let me touch on one thing real quick before I turn it over to Tina and John, and then we can maybe get to the Central District Health at the end of the program. The industry-specific webinars, what you're seeing on the screen right now is this week's schedule of our industry-specific webinars. Today is just general business, retail businesses. Tomorrow we've got places of worship, and then later in the week we've got some other specific industries. And we encourage businesses that are in with these industries to join and share their ideas, hear from other people on what they can do specific to their business. I think we're going to have a really good one tomorrow on places of worship, what the churches are doing in order to make their parishioners and people feel comfortable about coming back. As I mentioned, all of these are available on keepmeridianhealthy.org. You can go there, see the schedule. You can also register for those specific webinars right there. To emphasize again, this program is completely free, no charge to chamber members or non-members for businesses here in Meridian. So today's webinar, general business, retail businesses. Let me skip past our Central District Health person there. And I'm going to turn it over to Tina Upson. Tina is the Executive Director with Crush the Curve Idaho. And one of the most important things we've heard in order to maintain this is the importance of testing, the availability, and Crush the Curve Idaho has been leading here in the state of Idaho of being able to provide that information to businesses and the public. Tina, would you like to share a little bit about your program and what you can offer?
Yeah, absolutely. Thanks for having me on today, Sean. And I must say, I'm being tasked with crushing the curve across the state. Meridian is now a conversation topic when I'm talking to communities all over the state. You really are fortunate to have a chamber that just really attacked this and went head on and tried to figure out a template that will bless all of us, quite frankly, because at the end of the day, we know that people are going to come to Meridian from other areas. And if we can get more and more people to adopt these best practices, the better. So thank you for having me. I'm excited to, hopefully shed some light on the conversation of testing. At Crush the Curve, Idaho, we were founded by a group of CEOs from some very large employers around the state. And what they decided to do was say, hey, what could we do to help with whatever the struggle is that's causing Idaho to remain closed? Testing was a major thing, right? So we all see the news and we talk about shortage of testing and the lack of availability of testing. And so what I'm going to do is just try to briefly catch everybody up a little bit on what's being talked about and what is meant by a shortage of testing, and explain what we've done at Crush the Curve and how you can use that to help support and facilitate your company being a clean and a healthy company. So if you want to skip a slide forward for me, I want to talk about testing availability specifically in regards to what you see on the news all the time, which is testing shortages. And so when they say there's not enough test kits, there's not enough tests available, we can't test, our state had that same problem, not dissimilar from anybody else. And what they're talking about when they're talking about this is not the antibody testing, we're going to leave that aside, but they're talking about the active virus test. So this is the nasal swab that is done when somebody has symptoms, believes that they're sick, or has been exposed to the virus, the nasal swab test that tells whether or not they are sick. And so what we had in the state of Idaho, which is not dissimilar from other areas around the country, is we could only test certain people. We had to try to prioritize who should be tested. And so what that ends up doing is it allows a lot of people who needed to be tested and had the virus to not receive testing. Therefore, the virus continues to spread. And this is why testing is so important. What we've done at Crush the Curve Idaho is remove that issue for the state. Fortunately, we live in a state that isn't heavily populated. So we knew the formula and what kinds of test kit availability we would need to get our hands on in order to support the hospitals, support organizations. And now we're able to offer PCR, active virus testing, for any companies in the state as well, which has been really important for us to do. I want to touch a minute on symptomatic versus non-symptomatic. So what we find is, and what we hear in the studies is that upwards of 40% of individuals who are carrying the virus actively don't actually have symptoms. So this leaves us very blind when you talk about opening your place of business. If your requirement to employees is we don't want you to come in if you have symptoms, a lot of what we're hearing from employers who are part of our corporate program is, okay, but can I just get a baseline? My building's been closed for 90 plus days and I haven't had any employees in. Can I go ahead and get everybody tested even though they don't believe they're sick, just so we don't knowingly have the virus come in day one? So it's something that we often are seeing. So this is a non-symptomatic individual that's being swabbed for the active virus before business opening. So this is something that we offer. We have enough supply that we can actually do that. The alternative is the symptomatic. This is the person who feels sick. This is the protocol that we're going to start to see the guidelines come out, and hopefully our individual from the health district joins in and helps us on that as they start to speak to what we do when an employee feels sick or a family member of theirs is sick and believed to be potentially carrying the virus, right? We've also at Crush the Curve supported the local health care providers to have enough tests that they won't be turned away because they're not deemed an essential worker or meet certain strict criteria to try to preserve the limited number of kits. And so that barrier is now gone, where I think a lot of us had heard the stories, call it a month plus ago, of you may go in and be sick, but they're not going to test you anyways. We've really worked hard to remove that from the conversation. So testing is there for when your employees need it. And then finally, on the active virus testing, you're going to get those results and the responses. And this is where you're going to want to work with your HR and your legal department. The corporate partners that we have currently coming to our testing site, their employees are voluntarily agreeing to testing and voluntarily agreeing to share those test results with employers. That's something that these employers have already taken through their legal channels and have leveraged the data available to them through Emergency Act legislation that's been released for them to be able to feel a level of confidence and speak to whether an individual is sick or not sick. But as far as testing availability for active virus, we have that handled, and we'll talk in a minute. I'll share with you locations in which individuals here in Meridian could go get tested. Can we skip a slide forward? I want to touch on another type of testing. This is the antibody testing. And the reason I want to talk about this today is that we're finding with our corporate partners that they're running both tests. So for example, Jackson Food Stores, they test all of their employees, and I'm grateful for that. But when they first have them tested, they have them tested for both and they call it a baseline test. What I would call it is a gift because it's data and it's visibility that we simply don't have if individuals don't participate in testing. We can't say for sure, and no one's comfortable to say for sure that just because I have antibodies today, I have like a force field and I'm forever okay. And that's all arguable. But if we don't test individuals for antibodies and know who is currently carrying an antibody, therefore immune at that moment in time, we don't have any data to say how long immunity lasts for or what happens. And so these employers that we see, they're opting into doing both tests, the antibody and the active virus test, as what they're calling a baseline on their employees. And then they have different protocols. It depends on how they're structuring it, and they're following guidelines from either their own HR departments, et cetera, on when would retesting happen based on symptoms or exposures, call it a month from now, whatever that looks like. The method for testing on this that we use here, because it's a controversial test if you follow the news, the version we use is not. It is FDA approved. It's one of the only 7. We've partnered with the University of Washington, which is top-notch group of virologists there. And it's a blood draw. So it's a serology test is what they call it. I'm not a medical person, so I'm learning these words real time. And so I apologize if I butcher anything, but it's a blood draw, small tube of blood. Like if you've had labs done before, that blood is then sent to UW, spun down, and results are back within about 2 days. It depends on demand. Results could be a couple days later, but this again is checking for active antibodies, which means you already had the virus. Whether you actually had symptoms or not, you already had been infected and your body is presenting antibodies against the COVID-19 currently. We get a lot of, common questions about this one, specifically around FDA type of draw, those things. And so those are what we do there. Again, with results, this is a tricky one. This is one in which we want to be really careful about. We don't want people to ignore social distancing or people to not respect safe hygiene and their involvement in community health. And so we're really careful about that. But this is really good informed data if you think about situations that are going to come down the road. If I have an employee and if I'm an emergency response team and I have employees with antibodies versus those that don't, I'm going to make different decisions when I send somebody into a knowingly sick area. So this is just good information to have. I'm ready for the next slide. Great. So here, let's talk about testing protocols. It's probably mainly what you wanted to hear from me. I just kind of like to catch people up because it's a little tricky to 2 test. But when it comes to employee testing, for those employers that want to get a baseline or suggest some level of testing before opening up or in some regular cadence, the question is, are we running one or both tests, right? So I talked about the one that's checking for, are you sick now? The one that's saying, have you already been sick? And you're presenting an immunity right now with your antibodies. So that's the question that would be asked of an employer. And then logistically, we have we call it a forever site here at 10 Mile, right between the Paylocity and the Brighton building. We're moving it a little off the road, but we have a testing setup here that we can run 1,000 people through without breaking a sweat for these tests. This is a non-symptomatic site. This is not where you send an employee who's sick. But if there is testing that's needed, we don't expect to take those tents down for, call it a year even. I mean, as far as what we've planned for here on the ground. And this is available for our corporate partners that want to maybe have new employees run through the testing, or again, maybe run testing before they open up. As far as a cost planning perspective, knowing who the constituents are on this, as far as business size, it's just a conversation of, do your employees have insurance? If so, insurance is billed for it. It may be a cost planning exercise that you go through for the new normal, budgeting about 1.5 tests a month per employee or whatever that formula ends up being that starts to kind of come out in the data and the recommendations based on how you guys want to execute on that within your business. But it's definitely something to think about when we talk about the new normal, that this might be a budget line item, right, that you're looking at in planning for your company, that you can let the public know, hey, we don't just say stay home if you have the sniffles. We also just proactively get this test done and this follow-up test done based on CDC guidelines or whatever that ends up being for you to be able to speak to that with confidence. For larger employers, we can definitely mobilize and bring a testing unit there. But for the most part, it has been just really convenient for those Albertsons, Jacksons, all of those, just to send their employees or shift workers when it makes sense through these sites to be able to be tested. I think that's all I have. Maybe I have one more slide, Sean.
No, that's it.
That's it. So I hopefully I helped. Oh,
no, that's it.
Yep, that's it. Okay, good. So I think, I mean, those are the main points I wanted to cover, and hopefully, that sheds some light. I'm sure it'll open up some questions, but as in regards to testing, that's where we're at. We don't have a shortage or a lack of availability, and we have days here at the 10 Mile site that are just corporate only. It's very quick in and out, less than 5 minutes, no exaggeration. And we're just here to help support businesses and help them get that confidence from the consumer that they're looking for as well.
Excellent. Tina, thank you very much. Marlene, do we know if we had the person from the Central District Health arrive?
Yes, we do have Dico on the line. He is registered right now as an attendee. We are trying to get him in as a moderator. We don't have access to his microphone or camera right this moment. We are working on that. If you want to go ahead and move on to John, hopefully we can work out the last of these technical issues.
Excellent, thank you. John, are you there?
Yes, I am. Can you hear me?
I can. We can all
Great.
hear you.
Fantastic.
John, thank you for joining us. You're the general manager, store manager of our RC Willey here in Meridian. And I know you're also one of our board members here at the Chamber of Commerce, and we've had conversations about what RC Willey is doing. You've remained open during this crisis, but you've taken some measured steps to make your employees and customers safe and secure. Do you mind sharing with us what you've done and what you're implementing as far as best practices in your store that has a lot of traffic and front-facing contact with the public?
Yes, great. Thank you. I appreciate the opportunity, and Sean, thank you for organizing this and taking the lead on such a great program for the businesses in Meridian and throughout Idaho. I think you have to ask yourself a question. As a business, are you ready to do business during an ongoing pandemic? Until there's a vaccine or a therapeutic that can actually give more confidence than just knowing whether you've been sick or not, you got to figure out a way to be able to do business. Because there's going to be a danger gap between when you open your business and the virus is still out there and when we have an active vaccine. So the program really needs to be, being safe, just like our logo for this thing. We want to keep healthy and safe. But there's two questions you need to ask yourself. How will you make sure your customers are safe? So you need to come up with some protocols. You need to follow the guidelines of all the things that we've received from the CDC and from Central District Health here and from other guidelines that we know about sanitizing your hands and social distancing and wearing masks and coming up with touchless interactions with your customers, whether it be curbside pickup or curbside delivery or whatever it be, sneeze guards in front of cashiers. So those are some of the ways that you can come up with protocols to make sure your customers are safe. But there's another more important question, I think, is that how do you make sure that your customers and your employees feel safe? Not just the things that you've done, but they need to feel safe too, or else they're not going to come to your business. If you got nervous customers, they're not going to buy anything from you. If you've got nervous employees, they're not going to be working. And so you got to be able to answer those two questions. And so it's not enough that you clean, the high traffic areas and wipe down doorknobs and so forth. It's not enough to have masks and do social distancing. You have to tell your customers that you're doing it, whether it be through signage or through advertising or, these decals. I think they're going to be great to put on your business door because it tells the customer, it's a physical and a visual thing to tell the customer that you care about their safety and that you've done things. So it's important that they feel safe. So a couple of things that we've done here is we've got a sanitizing station at the front door. We've got hand sanitizer dispensers throughout our store in different areas, in high traffic areas. So customers can go get a squirt of hand sanitizer anytime they want. We have required all of our sales and cashiers to wear masks. And then we also have some disposable masks available to our customers as they come in, if they wanted a mask. We're finding that about half of the customers coming in right now have masks, but if they so desire, we'll give them a free disposable mask while they're in the store. We're not requiring it. As our store is quite large, we can maintain social distancing pretty easily, but I know there's other retailers out there that are requiring you wear a mask, and that may or may not become commonplace in the foreseeable future, but we are offering those masks. We do have signs talking about social distancing. We have decals on the floor at our cashier station to make sure that those social distances happened. We do have the sneeze guards in front of our cashier stations. We've also gone so far as to allow customers to make appointments, and they can make an appointment where they can have a dedicated time with an associate, and maybe not spend as much time as they would normally do in the store, because they would rather get in and get out with the things that they need. So we have the ability to make appointments. We're offering during this time, we know that customers are wary about bringing people into their homes, so we're offering free garage delivery, meaning that we'll take your stuff and we'll drop it off in your garage. Now, that doesn't include setting it up and so forth, because that's in your home. But if you do want to have a full setup, we do offer that as well. And all of our drivers are trained. They've got masks and gloves. They've been trained in social distancing, and they've been trained to not touch surfaces in the home other than the products that we're delivering, but they will be wearing gloves during that time. So we've offered a bunch of solutions to customers that may feel a little nervous, but also for customers that need to come in and get essential items to make their home a wonderful place to be. The last thing I'll mention that we've done is that the president of our company has taken the time to write basically an information letter to all of our associates and to all of our customers. It's posted on our website. We also sent it to our database of all of our customers that have given us their emails, in which we explained the things that we've done. And that is answering that question: how do you make your customers feel safe? We need to tell them the things that we've done, or else they might not feel safe. Even if you've done the things that you need to do to be safe, you got to tell them. And we found some really good success during the lockdown period. We were open just by appointment, just for essential items. Since the phase 1 has opened, we've kind of opened that up a little bit more. We're still limited hours, but between 11 to 7. But our customers were definitely eager and willing to get out and to buy things, and we're lucky to have a really good weekend. And the customers were very aware of the protocols that they need to do with the social distancing and masks and so forth, and they were very respectful of others. And that's the one thing that I've kind of found in our business, that we've had really customers that are very respectful of each other, and they're out there. They want everybody to be safe as well as themselves. And you know, I think you ask those questions of your business. Are you ready to do business? How are you going to make your customers and employees safe? And how do you make them feel safe? And I think those are the best practices that we've found here at RC Willey. So I don't have anything else, but thank you. Hopefully that was helpful.
Excellent. Thank you, John. And we'll get to some questions that people may have here in just a few moments. I did get confirmation that our representative from the Central District Health is on the line. I'm sorry I don't have your name, but if you would maybe unmute and introduce yourself, please.
Hello, everybody. My name is Dinko Milkovic. I'm a public health specialist, aka health inspector of Central District Health. And I'm just filling in for my supervisor, Natasha Fernie. And thank you guys for your patience. I've actually been able to listen to the audio since the webinar started, so I'm pretty much aware of everything that's been discussed. And I guess just if anybody has questions, feel free.
Would you mind sharing some of the basic guidelines that Central District Health is putting out there? This webinar is for kind of general businesses, retail, the ones that are able to open in the phase one. What are some of the basic guidelines that you're recommending these businesses do? I mean, we heard from John and what RC Willie's doing. It may be some of the same things, but what are your basic guidelines?
Absolutely. So obviously, businesses come in all various shapes and forms, but there's some basic guidelines that is recommended for all businesses. You know, one of the main things that businesses should implement is an employee illness policy. Really, if you think about it, that's the first line of defense. If you have an ill employee that's possibly exposing coworkers or customers to this illness, then that's something that should be controlled first and foremost. So if possible, it's highly recommended to develop an actual written employee illness policy so that everybody understands what the recommendations are and whatnot. Obviously, social distancing, that's another huge recommendation. It's something that probably the majority of the public is aware of. They've been seeing it all over the news. Their friends, families, coworkers have been discussing it. And once again, it should be something that is quote unquote standardized. So something that businesses have been doing is placing markers on the floor to clearly indicate where customers should be standing to ensure social distancing. So that is something that businesses should include in their plan to reopen.
Right.
Yes, go ahead.
The Central District Health has a lot of material provided, and that's one of the things that we're trying to help our members gather that information. Can you share a little bit of your website and some of the things that you have available on specific guidelines?
Yes, so currently posted on our website, we do have a basic guidance for businesses. So this is just a general guidance for all types of businesses. And we have recently posted guidelines for the curbside pickup operations for local food establishments. We also have guidelines for all businesses, workplaces, for responding to sick or possibly sick employees with COVID-19. So there's bound to be situations where an employee is either confirmed ill or suspected to be ill with COVID-19, and the guidelines are there to help business owners and managers kind of navigate the protocols to ensure the best outcome. We have also last week on April 30th, we have posted guidelines for the reopening of dining services at restaurants, and an actual checklist or form that local restaurants will need to fill out and submit to Central District Health for review and approval. So those are the latest guidance documents that have been posted, in addition to, of course, CDC links and the whole 9 yards. So
excellent. And for all those, you know, we are directly linking from our keepmeridianhealthy.org website to all of these guidelines and the available materials. So with that, Marlene, let's open it up for questions. I think you mentioned that we have some questions in the chat window. If you would read those, I'd be happy to have our panelists and myself answer.
You bet. Our first question is from Mick Armstrong, and the question is the expanded testing process collected by trained people? I have read that the self-collected samples are not reliable because often the individual does not go far enough into the nasal passage. Tina, I think that one's probably for you.
Yeah, that's a great question. And these are the kinds of questions and information that's out there that I'm happy to help distill for you. So what Crush the Curve does is facilitate the testing and make sure that logistically and equipment-wise and collection kits, we're there, we're good to go. But it's a medical provider that does administer the test. We're not there yet where the at-home test is going to be good enough. It will get there, right? But it's not there today. So if you come to our 10-mile testing site, for example, Salter Medical is delivering it here. If you're at our Eastern Idaho or any of our other 3 sites, it's a hospital or a medical provider like a Salter Health that's actually administering the test for exactly the reason that you're calling out.
Great, thank you. And our next question, I believe, also will be for you, Tina. It is from Robin Zadzora. And the question is, who gets the results? Does it go into a database or will it be protected?
Yeah, that's a really great question. So the results go back to the individual, certainly. The employee voluntarily has to say that the results can go back to the employer. And in the case when the employer is paying for the testing, there's things you can talk to your lawyer about on the wording for that. From a database perspective, I think in the way that you're calling it out, we do utilize pieces of information that are called out in the form that the employee agrees to for us to be able to address future health risks within the community, as well as when a vaccine comes, to be able to prioritize those individuals who have already have antibodies versus don't. So there's things like that can be done with the data that are spelled out there, but it's all in a HIPAA secure, what they call like a health cloud environment from a data perspective. So it's not like stored in a Google sheet or anything crazy like that.
Thank you. And Robin has asked a follow-up question. She says, the CDC, how many of the deaths in Idaho had pre-existing conditions? I cannot find that data. Also, based on who tested positive, how many had symptoms?
That is not for me.
All right.
Maybe our person from Central District Health. I don't know if that's data that they collect.
Dinka, would that be something that you have access to, knowing how many deaths had pre-existing conditions and how many people who tested positive actually had symptoms? Do you have that information?
I personally do not, and I do not have access to it. But possibly our epidemiology staff would have access to that data.
Okay, so I don't know if that's being made public on any websites right now, but sorry, Robin, I don't think that we have a thorough answer for you on that one at this time. And then the last question I have in our panel is from Sid, and the question is, after attending the webinar here, when will the materials be mailed? I'm in stage 1 opening.
Okay, excellent, Sid. I can answer that question for you. The Meridian Chamber will be receiving all of the collateral materials tomorrow, Wednesday. And if you've registered and you answer the survey that comes out after this, your attendance of this, we will be delivering and making available those collateral materials starting tomorrow. You'll be able to put the stickers in your window, you'll be able to put the posters up in your store, and we will start posting to our website the businesses that are participating.
Great, and that wraps up our questions in the questions pane.
Excellent. I would just like to thank all of you for joining us today, and please help spread the word to all Meridian businesses that we're here to help them open up in a safe and responsible way. The Keep Meridian Healthy and Open for Business is a campaign that really takes to heart the health of our community, both personally with the individuals in the community and the economy. And we want to remain open for business and be out in the front of any issues that may arise in the future. Like I mentioned, be sure and answer the follow-up survey we'll be sending to your email, and the collaterals will be made available tomorrow. Visit keepmeridianhealthy.org for more information on this program and to sign up for future webinars. Help us spread the word. Other businesses and industries specific webinars will be this week and next week. With that, I would like to thank all of our panelists, Tina, John, and our representative from the Central District Health. Thank you all for joining us today, and I hope you have a wonderful week and keep Meridian healthy and open for business. Thank you.